You've heard Shareef O'Neal's inspiring story of undergoing heart surgery to correct a life-threatening condition, but you're probably wondering what exactly was wrong with his heart and why was this such a severe thing? By the end of this video, you're going to understand what exactly was wrong with Shareef O'Neal's heart that required such urgent surgery. I'm also going to explain some really important things if you're an athlete when it comes to the health of your heart that could potentially be life-saving for you in the future. If you're a sports fan, make sure you're subscribed to my channel to get an interesting look at the medical side of sports, and let's get started. In the summer of 2018, Shareef started to describe feeling funny while he was at basketball practice. He was evaluated by UCLA doctors who ultimately discovered he had a condition called an anomalous right coronary artery. Let's look at our heart anatomy to unpack that phrase and understand what it really means. Your basic heart anatomy is you have 4 different chambers. You have a right-sided atrium and ventricle and a left atrium and ventricle. The right side of your heart receives blood from your body, pumps it to your lungs to get filled with oxygen, and then the left side of your heart pumps that oxygen-rich blood out to the rest of your body. Now, just like any other tissue or muscle in our body, our heart is muscle that needs oxygen and needs blood supply. But it doesn't get this from the blood in those chambers sort of seeping into the muscle. Instead, the blood supply to the heart muscle comes from the coronary arteries, coronary meaning heart. Naturally, we have a right and a left coronary artery that in general describe the portions of the heart that they supply blood to. With normal anatomy, the right and the left coronary artery come off of the heart at the level of the aorta. It's the big hose-like blood vessel that directly comes up out of the heart. Right at the base of the aorta, there's 2 little openings where the right and the left coronary artery exit. Those arteries then travel down around the heart to supply that oxygen to the heart muscle. Anomalous here means abnormal. So an anomalous coronary artery is whenever someone has the position of these coronary arteries in a way that's abnormal or somewhere where it's not supposed to be. This can happen to either the left or the right coronary artery, or in some cases can even involve both. There's all kinds of different patterns of where those different coronary arteries can anatomically be abnormal where they come off of the aorta or come off of each other. Remember, the whole purpose of these coronary arteries is to supply blood, oxygen, and nutrients to the heart muscle. Without that blood supply, that heart muscle can die. And this is basically what happens when someone has a heart attack. Those coronary arteries become narrowed and eventually can shut off, and you get death of that heart muscle, which is a heart attack. Whenever you have an abnormal position of these coronary arteries, even if there's no narrowing of the blood vessel, it can be positioned in such a way that it compromises the blood flow to that heart tissue. Whenever this happens, the heart tissue in the body reacts and gives you a variety of different symptoms, like what Shareef O'Neal had. In his case, he described feeling funny, but oftentimes people can have some chest pain, they can feel short of breath or fatigued, they might even pass out or have something that we call syncope. If an athlete has one of these anatomical variations that's causing symptoms and causing poor blood flow, then they'll have to undergo a type of surgery like O'Neal had to basically correct the anatomical positioning and correct that blood flow of these vessels. Now, this next part's really important because this is information that could potentially save your life someday. Risk of sudden cardiac death is one of the biggest things that we're trying to look for as doctors whenever we evaluate an athlete before they compete with their sports team. You remember when you were in high school or middle school and you had to go and get your physical where the doctor did that exam and checked for a hernia and asked you all those kind of questions? The reason we do that is in part to look for any risk factors of these types of conditions like Shareef O'Neal had. The American Heart Association has specific guidelines in terms of what we ask with our history and what we do with our physical exam to try to identify these risk factors. The hard part for us as doctors is a lot of this depends on the athlete giving an accurate history of their symptoms. There's a number of these conditions that can put you at risk of sudden cardiac death, and what Shareef O'Neal had is just one of many. Sometimes we can see abnormalities on our physical exam with things like a heart murmur, and sometimes we can pick it up in other ways, but a lot of times it comes down to the athlete's history if they've had any concerning symptoms before. In the NBA and other professional sports leagues, there's often more common cardiac screening with tools and tests like ECGs to look at the heart rhythm and echoes that are basically ultrasounds of the heart. But in high school, middle school, and even at most colleges, we aren't doing those specific tests to always find these problems. It doesn't matter if you're playing pickup basketball with your friends or you're playing for your school sports team. If you're an athlete exercising, you need to be aware of certain symptoms and the importance of telling your doctor if you've had them. If while you're exercising you experience any sort of chest pain or excessive shortness of breath or fatigue, pounding or uncomfortable feelings that we call palpitations, and especially if you actually pass out and lose consciousness or have an episode where you feel like you're on the verge of passing out. These are all the types of things that you want to talk to your doctor about, and make sure you tell them whenever you get your physical if they ask you about these symptoms. Look, I know it might seem embarrassing to complain about some symptom or go see a doctor based on what you feel when you're at some pickup game with your buddies, but knowing the importance of these can really save your life. A lot of these conditions that cause sudden death in athletes from heart problems initially present themselves just with some of these symptoms. We can't always pick these up with physical exams, and so it's really important that if you experience any of these concerning symptoms, you make sure and tell your doctor about what's happened so that they can do more investigation like they were able to do with Shareef O'Neal, and honestly potentially save his life. Make sure you also tell your doctor if you have any family history of heart conditions that you're aware of, because this could also influence what they might need to evaluate if you have these symptoms. Have the strength, have the courage to talk to your doctor and get checked out like we saw with Shareef O'Neal, so that if you have something like this, we can find it, we can help get you better, and we can help keep our athletes safe. That's it for the video, everybody. Thank you as always for watching. Let me know any questions or comments you have below. And until next time, we'll see you later.